how could we remedy doctor shortages in less populated areas?
The conditions are such that doctors and medical staff may be looking elsewhere. So incentive for these places that need medical attention, medical staff, incentive for medical professional people to want to go and help.
What kinds of incentives do you think?
Well, money is always a factor, but conditions too. I mean, some of these places might not have, all the amenities of the city, or anyway, that kind of thing should be looked at.
I feel like they should kind of be looking at the areas in the country, in our cities and provinces, seeing which part needs the most help and trying to accommodate to them more specifically instead of kind of turning a blind eye.
I think we're kind of at a stalemate as far as physicians go, even in populated areas. It's sometimes difficult to get a new physician if yours retires or leaves.
How could we fix that, do you think? Could the government do anything?
I don't think so. I don't see how the government can do anything. I think we just have to maybe have more doctors graduating, maybe open it up more.
I think with the way that you become a doctor in Canada, I think we're kind of misguided for that route, because it takes so long to become a doctor in the first place that's a huge reason that we have a big shortage of doctors. Myself, when I first graduated from high school, right now I'm 4 months and then I'm done my biology degree. I'm only 21, but that's what I'm studying in university. And at first I was doing biology because I was interested in chiropractic. But then when I actually calculated how long I'd have to go to university for, I dropped that idea, and now I want to become a high school biology teacher instead. So med school is the way that we do it in Canada. I really truly believe that we do it in the wrong way. It takes way too long. The fact you have to get an undergrad first and then go for it. I think if we follow along the way that Europe does their design for med school, would be a lot more direct, and honestly would keep more of our med students in med school. Otherwise, a lot of students look at how much student loans you're going to take on and how long you're actually going to study before you get to practice as a doctor, and it draws them away from it. So I think that's changing the way that you become a doctor could really remedy that situation.
There's a lot of new immigrants that have been doctors in their home countries, but to come and become a doctor or a nurse within the Canadian system, they have to re-certify. And a lot of them don't have the money. They have to work in order to support the family that they've brought with them. And I think that is right there a huge problem that we're not allowing. We're asking these people to come, but we're telling them to be shoe shine men.
Perhaps the cost of becoming a doctor, I imagine it's what puts a lot of people away from it. It's a strenuous amount of work, and then to have that the debt afterwards for so long. Maybe to make the career more accessible, then we'd have an influx of doctors wanting, and then you'd have the more personnel. I bet the personnel is mostly the problem.
I think we need to, I was shocked when I found out in British Columbia that the average doctor is only $31 for each person that they see. That's what they're getting paid. So I think that needs to be remedied. We need to look at maybe a different way of offering care. I think we aren't using our nurse practitioners as we should. I think a lot of things that I make an appointment to see a doctor just to get a prescription refilled, for gosh sakes, just let me see the nurse practitioner, and that would free up doctors so they're not seeing they're just not under so much pressure to get so many people in all the time. So I think we need to do a nurse practitioner and doctors in one office together. I think that would be a really good solution. And in that case, we need more nurses trained. So we need to open up and get more seats for nursing and try and make it a job that people want to do.
Oh, we've got to put more money into the the provincial health budgets. They just got to start hiring people back, and sort of put back save money by kind of putting back the community health centers. Like, there used to be more hospitals and they got consolidated, and that probably didn't help things. So there needs to be more distributed local health care so that people can find a doctor where they need it.
I'm not really sure how to do it. I've been out without a family doctor for over 2 years now. and sitting on waiting lists and calling whenever I can. And thankfully, I've finally got someone who's willing to take me on, but still haven't met them yet, so we'll see. But to solve it, I think there needs to be an increase in the number of students that are coming out of our medical schools, and an increase in a way to keep our families, like our doctors and our family doctors, here, because you can make a lot more going to the States, and it's not that difficult to go down as a doctor. So if you can, there's got to be a way to keep them here.
I live in Taiwan right now. What they usually do is doctors would spend 2 years and they'd work at the hospital for a very, very low wage to get their I don't know, what would you call it, in-house experience. Yeah, and then they could go out and start out their own practice, but they got to do 2 years first. And you're right, it's almost hilarious seeing these doctors from India and China, and they're great doctors. They've got their degrees there, but Canada won't accept their degrees, right? At least that's how I understand it. So yeah, let them be doctors right away.
Well, I think the problem dates back maybe 20 years ago when it was actually, I think, the Liberal Party at the time cut or limited enrollment in medical schools. And so therefore, if you don't fund students going into medical school, you don't fund doctors. So I think that's maybe part of the problem. And certainly the problem is now fixing it, not only maintaining, but maybe increasing enrollment in medical schools.
And it should be easy transition between the other country to Canada when the doctors come from. Well, it's my personal experience. One of my friend who was doctor in India, he is driving taxi in Canada when his talent is could have been used for overcome this shortage.